Hi, and welcome again to another edition of Meet the Body, where we meet ordinary people doing extraordinary things in the body of Christ. And today I'm honored and delighted to have a friend of mine I've never met in person, but I know him from Facebook, and he's got a YouTube channel of his own. This is Andrew Rodriguez. He is a therapist who specializes in an interesting field in what we call sexual attraction. I got this right, sexual attraction fluidity exploration. And this is a field where if someone who has a same-sex attraction wants to diminish that or figure out, how to deal with it, or maybe, recover or discover heterosexual attraction, Andrew is someone that he may want to come to and do that. And it's a fascinating field. It sounds like the results are really impressive. So Andrew, welcome to Meet the Body.
Hey, thanks, Rick.
Yeah, let's start with let's pretend like you and I were walking into a skyscraper, and we're going to go. We've bumped into each other. We're in the elevator, and give me your elevator pitch. You get off at any floor you want, who you are, what you do, and what you want to tell our listeners.
Okay. Well, yeah, I'm a therapist. As of December, I'm now a licensed professional counselor, but I've been counseling as a lay counselor or as an extern. Like I had my degree, but was working on my hours toward my license for years. So I got started in this field of working with people with sexual struggles back in like 2006. When I was working on my undergraduate degree, I was working on my bachelor's in psychology at Valley Forge Christian College, which is now University of Valley Forge. And so I did my internship at Day 7 Ministries in Lancaster, PA. And at the time, they were one of the member ministries of Exodus International. Okay. And they didn't just deal with homosexuality, they dealt with all sorts of sexual issues, sexual abuse, pornography, sexual addiction, infidelity. And one of the great things about that internship experience was it was very hands-on, unlike most other undergrad internship experiences. So I actually got to participate in the recovery groups. And the model they use is we got the guys coming in with unwanted same-sex attraction, forming groups together with guys dealing with sexual addiction of a heterosexual nature, pornography addiction, and they form an accountability group together in a recovery. There's usually a lesson, time of praise and worship, and then time of sharing in smaller groups.
Okay.
And so that was a powerful experience. And then I went back to my campus, and at the time we didn't have any counseling services on campus, but I had a lot of friends who were struggling with different sexual issues, not just homosexuality, but there was no help available at the time. And so God put on my heart to start up a support group for men on campus. And long story short, that's what I started doing around 2006, 2007. And then I started up a group for guys dealing with abuse from their past or past trauma. But every school year, about half the guys are dealing with same-sex attraction, the other half with sexual addiction issues. And I ran that for 8 years. And then in that period of time, I started going to graduate school. And when I graduated, by that point, the school finally started offering counseling on campus. So then I had my degree, and I'm like, well, hey, I've been giving you guys free counseling for years. Why don't you hire me? So, and then also once I got my degree, I actually went back to Day 7 Ministries and I started working there. So I've worked quite a few places. I was working a few different practices. I was also doing counseling at my church. Right now, I'm primarily here at this office, which I'm in the practice, or I'm in the process of buying the practice where I work at. And I'm going to be launching my own counseling practice here called Integrity Christian Counseling. So that's kind of the work I do. I work with a variety of people, but probably about a third of my caseload is guys dealing with some sort of sexual struggle, not just homosexuality or same-sex attraction. And the approach I take is based off of Joseph Nicolosi's work, both Joe Nicolosi Sr. as well as his son, Joe Jr.
Right. So yeah, I started. I ran across an article about the psychological aspects of where a same-sex attraction can come from, and I was blown away. I mean, I come from I graduated from college in 1980, and back then it was pretty much people just figured that sexual attraction is you're born with it. And I can see why. And then we'd say, well, why don't you, where does that come from? And as a heterosexual, you'd say, well, I never had to think about it. It just came naturally. So it came naturally for me, it came naturally for them probably. And we figured that eventually we'd find a gay gene for that. But science moved on. And what did science tell us about that, Andrew? Maybe you could.
Oh, yeah. Well, they're never going to find a gay gene. What's
right.
the idea of a gay gene? Anyone who, not to disparage you there, but right. Anyone who sort of espouses the idea just sort of betrays their lack of understanding of how genetics work. So, right. There's not like a heterosexual gene either. It's not our genetics don't have direct control over our thoughts and behavior.
So I don't have a heterosexual gene either, do I? That worth saying?
Not in that sort of way that it determines what you find attractive or appealing, or and I even hesitate to use terms like heterosexual and homosexual or gay, because these are labels and these are terms that we place upon an experience that ends up creating this idea that there's a fundamental difference, a categorical difference between humans. And that is like really at the core root of this whole issue. This idea that we're split into these categories. There's straight people, there's gay people, there's bisexual people, and it's really not true. And that's really one of the core issues behind the same-sex attraction itself. When we work with guys,
so you're not forced into a situation necessarily when it comes to your attraction sexually. It's fluid, and I think that's what which seems to be what you're in that regard.
It's important to understand that same-sex attraction is an experience. It's not doesn't determine something about who or what you are. We've taken that as a society and made it mean something more than it really should mean. And whether you view it positively or whether you view it as negatively. So we've got the pro-gay approaches. Well, if you experience same-sex attraction, therefore that indicates what you are. That indicates that you are gay.
Okay, yeah.
And there's this idea that is something that is how you're designed or you're destined for sexual or romantic union with members of the same sex. Right. Now, the idea was it must be something natural and innate. Therefore, there must be some biological explanation for it. Well, we keep coming up dry when it comes to searching for that biological explanation. And so years ago, I told people, look, they're never going to find a gay gene. All right. And they're going to keep searching for some sort of biological explanation. Maybe it's in utero hormones. And maybe boys didn't get enough testosterone in the womb, and so they became more feminine. Well, that's not determinate enough, and doesn't apply to every guy out there with same-sex attraction, and also doesn't really do much to explain things for girls. So it's just grasping at straws with some of these explanations. There's some other more fringe explanations out there and that are harder to explain. But years ago, I said, it's going to get to the point where they're going to give up on finding a biologically determined explanation for same-sex attraction.
Haven't they kind of given up? I mean, it seems like
scientists have mostly given up.
Okay, yeah.
The media and the educational institutions, the gay rights lobby has not given up on that narrative yet. Okay. Because they know the public is rather ignorant about what the science actually shows. So they're just going to keep beating that drum, even though you got experts who study the stuff, like, say, Lisa Diamond, she'll say, we need to stop saying born gay and cannot change. We need to stop saying that you're just simply born that way. because it's scientifically inaccurate, and really we don't need it in order to fight for the rights that we've been fighting for. It was expedient in the past. It seemed like the best foundation for fighting for gay rights in the past, but it's not true and not necessary anymore. And the reason why is like what I've been saying years ago, is it's going to get to the point where they just don't care about how it develops, because it's going to get to the point where your sexuality is really whatever you want it to be. And that's what we're seeing these days. Sexuality itself is fluid, not just sexual attraction, but sexuality. Gender is fluid. Your identity is fluid. It's going to get to this point where there's such a rupture between your body and your identity that they're unrelated. That's what we're hearing in the current wave of feminism and of this identity politics. It's, well, sex and gender are two different things and not necessarily related. Well, that has an impact as well when it comes to sexual orientation. It just makes it so you can be whatever sexuality you want to be, or whatever you feel that you are, whatever you discover that you are. And that can change. Of course, it's going to mostly change toward non-heterosexuality to the activists. And they have a problem with using some sort of effort to change it toward heterosexuality, but they'll be happy to see it change toward non-heterosexuality.
Yeah.
So there's a clear agenda there.
Okay. So, we're going to give the devil his due and say, okay, because it does seem to me that there was a time in the 80s and 90s where there was like, hey, if you're gay, you can change. It's a behavior thing, and you've got to modulate your behavior and become heterosexual. And here's how you do it. And then, and then there was all the, and it basically did not work. I think maybe it did. I don't know.
Depends on what. Yeah, it depends on your criteria, because
okay.
All right. So
let's say the joke was, or not the joke, but the denigration is, your therapy became called, pray away the gay, for example, and say, I went to these sessions. I guess there's a movie now where you go to a camp and you pray away the gay. And then all it has to take is some guy said, I went there, I felt like I was abused, whatever, and I'm still homosexual, and it's all a fraud. Okay, so why don't you address that from, what do you see? I mean,
because you got to, I guess, let me give a brief history of counseling efforts for unwanted same-sex attraction. So
great.
It helps for people to have that context, because what we're dealing with right now are all these bans for so-called conversion therapy, which is a term that we don't really use. It might have been a time in the past that clinicians did use the term conversion therapy, but the term has been warped so much and it's been used to lump everything together with things that we don't espouse, and no therapist, at least not in modern times, actually uses. So we distance ourselves from that term. But anyway.
So you follow the science is what you're saying.
Yeah, it's kind of important to do that, right?
Yeah.
So, all right. People have to remember that there was a period of time where there was an understanding that having a compulsion or desire to engage sexually with a member of the same sex was disordered. And that really came out of a certain worldview, a more modernistic worldview, that are more essentialist worldview, meaning that there's something normative about our sexuality. There's a norms that we're designed to go toward. Even if you weren't even a believer, if you weren't religious, you understood that the body was designed a certain way, or that it's meant for a certain type of a sexual expression. And so something that deviates from that, it made sense for it to understand that that's not normative and is disordered in its desire and its expression.
So natural law kind of a...
Yeah, natural law was at one point understood even among secular psychologists and clinicians. Okay.
Before the politicians got a hold of it.
There is that. There was a very strong political movement to change the designation of homosexuality per se as a disorder.
Okay.
And if you look back to 1973, the decision that was made, it was made under a lot of pressure for the few years leading up to the APA, the American Psychiatric Association, changing their designation of homosexuality, removing it from the DSM. It was preceded by all these protests by gay activists, and they would picket at APA meetings and conferences, or just barge into their conferences and demand to be heard. And they viewed that being seen as mentally disordered in some way was harmful in itself.
Okay.
And so they wanted to ride on the coattails of the success of the civil rights movement and espouse this idea that we're not dealing with a condition. This is what we are. This is who we are. And there's nothing wrong with who we are. We want to accept who we are as gay. And so you see this idea of sexual orientation being used as an identity. And so it really was under a lot of pressure. So there was a vote under a lot of pressure to change things. There wasn't full agreement, and there wasn't a lot of research done leading up to the decision. Like, well, okay, there was a little bit of research, particularly by Evelyn Hooker, that looked at levels of distress among the homosexual population that was in therapy versus homosexual population that was not in therapy. Well, I don't see much of a difference. We now know years later that, oh my gosh, compared to the general population, people identify as LGBT have higher levels of distress and more mental illness and substance use. But what we've done now is we've used the idea of stigma and minority oppression or minority stress to explain it all. Okay, as a blanket statement.
Right. Yeah, that's what's causing the higher rates of whatever, suicide or depression. Is people don't accept me for who I am.
And so it became where the sexual orientation became something that is a stable trait. It's something that's a part of your identity, like skin color. But instead of understanding this may be an experience, some sort of maybe pervasive experience, of course, but it doesn't necessarily mean it's innate and immutable. But there's been a lot of opposition to do more research to study that idea. Anyone who continued to espouse the more natural law view was marginalized and denigrated. Mm-hmm. And so research into counseling efforts for sexual attraction change was not promoted, of course. And so for years, we just had this mantra, there's all this pressure, there's both APAs, Psychiatric Association and Psychological Association, put out statements that they condemn any sort of therapy. They called it, whether it was reparative therapy or sexual orientation change efforts, however they term it, to condemn any sort of effort. But at the same time, they weren't going to promote research to really definitively see if it works or if it was harmful. So, but anyway, going back to 73, up to that point, it was within the norm for regular secular psychologists to practice counseling to help someone change their sexual orientation, their sexual behaviors, or their identity, their feelings. And that depended on the psychological theory of the clinician. So a behaviorist, they don't care as much about feelings. And you've got to realize in the 60s and 70s, behavioral therapy was in vogue. Because if you understand psychology, the history of psychology, you know there's waves. You know, in the early 1900s, you had Freud and psychoanalysis. That's the gold standard. Then in the 50s, 60s, you had behavioral psychology. And then 60s, 70s, you had humanistic and client-centered and person-centered psychology. That was in vogue.
You go from Freud to Skinner to
So depending on the theoretical approach of this therapist, they're going to have different emphasis. So you had people like Volpe, who developed systematic desensitization. He developed a protocol for treating homosexuality, but of course it's going to be focused just on the behavior.
So he every time that you'd look at a naked picture of it, like a naked man, you'd get a shock or something.
That might be, yeah, well, that's where
That'd have been something.
there might have been
might have
some
been.
aversive techniques used, as well as other things like conditioning, like you use some techniques to say address what you believe there might have been a fear of women, and then
Okay.
work on assertiveness training,
Okay.
as well as aversive techniques to reduce the pleasure associated with homosexual stimuli and associate with pain. That
Oh.
might have had, because they're addressing just a behavior, that might have had a short-term effect. They did some research and they showed, oh, this does seem to work. But long-term doesn't seem as beneficial, because you're not really addressing what I believe is more someone coming from a more developmental approach. They're not addressing the core issues, really.
Okay. Well,
So
maybe you can tell us what the core issues are as you see it. Let's.
So yeah, the psychoanalysts, they always had the tradition of a developmental approach, seeing that sexual attractions were rooted in relationships to primary caregivers, and that was in general, not just dealing with, say, homosexuality, but that's the accusation a lot of psychoanalysts and psychodynamic therapists get. They're so focused on sex and how child development addresses that.
So we're talking mommy issues.
Mommy issues, daddy issues. It's like, but as modern psychodynamic theories develop, they realize that, yeah, it's true that attachment is very important.
Okay, the ability to attach to your mom or your dad.
Yeah, you have to understand. This is one thing that's helpful.
And we're talking about something that you say this is legitimate, right? But now is what you're saying, or
yeah, this is more where I'm in line with. It's
okay.
This idea. When I talk about this issue with people, I try not to just go right to, well, here's how homosexuality develops. This is, or
right.
At least based off the developmental model, but rather, how does sexual attraction in general develop? What is normative sexual development? And because if you're a guy who never experienced same-sex sexual attraction, who just was only ever attracted to females, you may just think, well, it's just natural, and you just sort of take that for granted.
Yeah.
And so when we understand, well, actually, there are particular developmental steps that got you to that place where you were attracted to the opposite sex. And it's important to not take those things for granted. And a culture that promotes those factors, I would say, it's a fairly healthy or healthy enough culture, not just a culture at large, but a family culture, a faith culture. So you realize what do kids need to get to that place where when they become adults, they're ready and they desire union with someone of the opposite sex and ready to start a family and to enjoy healthy intimacy with their spouse. Like, there's some important developmental markers that they need. They need to have a model at home of a mom and a dad who love each other, who both represent masculinity and femininity. And then through their partnership, they love the children in a way and they bond with them. And boys and girls, they both need mom to be feminine and nurturing and a secure base. Now, of course, moms and dads, men and women, they're going to vary in their own degrees of masculinity and femininity, and that's okay. All right, there's always individual differences, but in general, boys need moms and girls need moms who are going to be nurturing, and because she's going to be the first primary caregiver that's going to give them a sense of security and safety, give them their basis for trust in the world, trust in themselves, and that's your established foundation for identity. It's right there.
And if she doesn't, then there's going to be some kind of trauma with that child.
And we might not always recognize that as trauma.
Okay.
But if you look at, say, Nicolosi's work, he said, what we do is we help you with resolving trauma. Now, a layperson hears that, and a lot of therapists too, they hear that and think, well, not everyone's been traumatized, and because they instantly think of abuse or molestation. Not necessarily so. When we talk about trauma, I mean, what is something that disrupts the natural developmental process? If something disrupts that, what we need for healthy development, then that's a trauma.
Okay.
So yeah, if there's a malattunement, then what happens if there's a malattunement? Say, for an example, if a boy is malattued with mom, say the mom is giving him more attention than he really wants at that moment, and he's trying to turn his head away, but she's trying to engage him.
Okay.
Well, she keeps engaging him. We're talking about as an infant, like a little baby. He's going to shut down because, all right, she's overstimulating me. I'm just going to shut down. All right, that preps a boy for disconnection. Well, what's the next stage of development for that boy? Is to assert himself and become more independent. But he still needs mom as a secure base. So sometimes, though, if it's difficult to trust that she'll be there, that she's there in the way that he wants, that can develop anxiety. And so and that shutdown can happen in other ways too, where mom is not attentive enough. And so he's crying out for her all the time and doesn't trust she'll be there. So that's more of that could lead to more separation anxiety.
Okay.
Well, by age 3 or 4, for a boy, dad needs to become more salient to the boy. Dad needs to play a more significant role in helping that boy now wean from mom and start to identify with him more and realize, okay, now I know what I am of my own person, because we first start off with like a symbiotic relationship with mom.
Yeah.
And then it's just every child does. And that's just how the attachment works. We have a hard time telling where I begin and where mom ends, and etc. But then we start by terrible twos. We call it terrible twos because the child now is independent to some degree and wants to explore the world and assert himself. But what happens, dad needs to become more salient. The boy recognizes dad as, ooh, that's who I'm going to grow up to be like. And a father will be salient to the boy, meaning a figure that the boy wants to emulate and be like, if the father is perceived as both strong and benevolent. So strong, he's masculine, he's capable, he's competent, he's tough, but he's also good. He doesn't use that strength for harm. He's not scary, but he's also engaging, he's fun, he's safe, he's comforting, while he's also challenging. So that helps the boy identify with dad. And then dad becomes a gateway to the world of men. And not just dad, but also older brothers, other peers, other family members. So maybe dad's not present as much. There's maybe other male role models in the home or in the community that the boy can develop in a bond with and then identify with. And that preps a boy for going into puberty, where he so identifies with his own sex that when puberty comes and the rush of new sex hormones come, it's the opposite sex. It's the sex that he does not identify with, that he does not feel like he's a part of, that becomes eroticized. See, what is exotic then becomes erotic. Now, there's a whole theory called exotic becomes erotic that I'm not going to get into because, but there's a basic concept there that's true. It's what is different from me is what I want to bond with. That reflects the complementarity that God designed male and female for, that they're two different sexes who then become one flesh. And so what prepares a boy to want to unite with woman is the realization that he is a boy and that he's fully identified with his own sex. And so it's the opposite sex who seems now different and appealing. Now, what can also hurt that process if he's also experienced rejection from females in different ways, or if he feels intimidated and feels like he doesn't have what it takes to offer anything meaningful to a woman. So that can hurt that as well. But a lot of times it's the lack of identification with his own sex that preps him for actually finding his own sex more attractive.
Now, what are the things that would cause this young man to not identify with his own sex? What are the typical things that you see as you?
Well, I mean, I'll say these things and I'll people, oh, that's not true of me, but it's like about a third to three quarters, not a third, but like 2/3 to 3/4 of our cases. There's some sort of lack of identification with with one's own sex, a lack of feeling competent as a boy, as a male, and it could be through dad not being present, dad was not for death, or dad just divorce, separation. Maybe dad was away on business a lot, and then when he was home, he was preoccupied. He didn't sort of go outside of himself to try to engage with his son.
The natural bonding just wasn't taking place.
Wasn't there. And if it wasn't natural, then dad wouldn't put in the effort. It's like dad expects the son to be more like him. And if the son wasn't more like him, then he just throws his hands up and gives up, or or worse, he's verbally abusive. And so, and this is fairly textbook. And so a lot of people are already familiar with these ideas, and but so many of my clients, it's what's oftentimes true for them. So that will be some of the early issues that might cause, we understand that there's kind of different types of same-sex attraction, or some different contributors to same-sex attraction.
Right.
This is one of the more, this is more of the situation for a guy who develops same-sex attraction at an earlier age. Right. And maybe even presents as more effeminate, and others, well, then what happens? Peers pick on him, ostracize him. Siblings ostracize and pick on him. And so it's reinforced. There's something different about me. I don't fit in. So it might be through the relationship with dad. It might be, or even if dad's present, but if mom's overbearing and dad doesn't stand up to mom enough, dad's perceived as weak instead of strong. Dad may be too benevolent. He may be too passive. He may be rather not benevolent, but rather he's just too passive.
Yeah.
And so he's kind of he's not a salient figure. He's not a figure that that boy wants to be like. So it can be either way. It might not always be the dad who's rejecting, but it could be the dad who's he's so insecure himself, and he doesn't really present himself as a strong figure that boy wants to be like. So it might not. So there's potential options with dad, or contributing factors there with dad, but not always. There could be also just an older brother who's constantly bullying him. It could be through rejection from peers. There's also situations I've worked with, there's no abuse necessarily, just maybe the dad was just emotionally distant.
Yeah.
But like I worked with a guy one time, for him, no, my dad was fine, but he was just kind of didn't have much of a personality. He never really bonded with him. And then he had a ton of sisters. So he identified more with his sisters, bonded more with them. And his male peers, he just felt like he was above them. They were into things he didn't care about. He didn't care about sports. He'd rather read, and he didn't feel inferior, but there was a disconnection. There was ultimately, either way, there was a lack of identification with his own sex.
Yeah.
Either because he felt inferior, or because he felt like, I'm just too different. I don't really care about them. And he more identified with his own sisters or female peers. They seemed to have more meaningful conversations than when he was with his guy friends or the other classmates.
Okay.
So.
Okay. If a child has a dad who's kind of henpecked, not really respected, not kind of gets pushed around or whatever, and kind of a weak, does that hurt the identity? Because I think
yeah, that's what I was saying. Like that could be the situation with the passive dad.
Passive, yeah.
So
okay, so puberty comes, and puberty sets this in motion, this thing in motion, where you all of a sudden the other sex that you haven't dealt with all of a sudden is very interesting to you, and that comes up with you said something. It comes up with all of a sudden sexual desires start coming.
Yeah, let me backtrack a bit too, because there's the other element there is also the temperament of the boy and the ways he coped with those developmental wounds. So it's not just that these developmental wounds are present, because I've worked with plenty of guys who had similar stories, and one never developed same-sex attraction, and others did. So it could be that some of the deciding factors there may be more the temperament, and usually it's it's going to be the guys with more of the sensitive temperament. So they're going to take in those rejections or a disconnection more to heart. They're not going to be as resilient. They're not going to assert themselves as much.
Okay.
They're not going to stand up and be like, hey, I want to be seen. I want to be heard. Because it gets either because it did get squashed down, or they just didn't have the courage to be as spirited. And so the other thing is what might happen is they learn to protect themselves from further hurt. And so one of the phenomenon we observe is called defensive detachment, where safe is a classic case. So everything I'm saying is a lot of generalities. I don't want people to think that this is going to be the case for every single person.
Yeah.
A lot of times you start learning this stuff and you start trying to fit everyone into this model.
Exactly.
It's not going to be a perfect fit for every person.
Yeah.
All right. About 3/4 of the clients we deal with. Now, this doesn't mean 3/4 of the gay population, because not everyone from the gay population is seeing us for counseling. So I'm just talking about those who come to us for counseling.
Let's say, there's something I want to work on something in my sexual identity, and they come to you, and so you start doing this, what you call exploration, sexual exploration. And
so another phenomenon we often observe is what we call defensive detachment, in which, say, if a boy who's going back to that attachment issue with mom, there's a malattunement there, and so the boy disconnects. So it's like a form of dissociation. Just all right, to deal with the malattunement, just going to disconnect a bit, and that preps the boy for when the dad isn't as salient, and the boy longs to bond with dad, but the dad isn't there in the way that he needs the dad.
Okay.
And so to protect the boy from further hurt, this is unconscious. This happens. This is not purposeful, but will defensively detach from dad, meaning to defend himself from further hurt, will detach. Will just oftentimes go into his own world. Dad wants to engage him in sports or rough and tumble play, and the boy shows lack of interest, would rather read books, would rather go in the kitchen and be around mom for a while. And just, or dad yells a lot. He's just real loud. He's not even being mean or abusive, but he just got a loud voice. The boy retreats, goes within himself, goes to his room, plays with his sisters. It's detaches from the world of men, or protect himself from further being hurt by the rejection, or not always is it overt rejection, but just a sense that I'm different. I can keep myself from feeling that, and really what it is shame. Keep myself from the shame, the feeling that there's something different about me. Then I'm going to do what I have to do to protect myself from that.
Gotcha.
So the counseling we're doing ultimately is getting to that shame, that shame that you are different and don't deserve to be part of the world of men. So that earlier when I was talking about with all this stuff about the labels we use, the terms we use, like gay and straight, and this idea that there's a fundamental difference between guys with same-sex attraction, how I don't find that helpful in general, but also that sort of is at the root to a lot of the struggles that these guys have. It's this idea that even our churches keep promoting, even without realizing it, that there are gay guys and there are straight guys, that there's a fundamental difference between them. And yes, there are very unique experiences that a lot of the guys with same-sex attraction have. And it's helpful for them to know that there are others out there with those experiences. I'm not saying that they just need to get over it or something. Definitely not saying that. And that you don't need to be specialized in this sort of issue to help guys with these issues. There's some training that is helpful to have. But one of the core things we do in the counseling is help them get to a place where they have a felt experience of commonality, of really identifying with their sex.
Okay.
Going beyond the cognitive understanding, but really have a new felt experience and really nurturing that and maintaining it and being in there. So in therapy, I describe this as sort of having three battlegrounds. The one is past, present, and future in some ways. You can look at it that way. Is we use the actual fantasies instead of taking like a pro-gay approach where we're just, oh, well, if you're having the same-sex attraction, that must mean you're gay. Embrace it, live it out, and the more you come out, more you go through the coming out continuum, the better your life will be. You'll be better adjusted. So just embrace it and indulge it in whatever way you see fit. Yeah, be who you are.
Okay.
So instead of that, but also instead of the other extreme, the anti-gay approach, like, oh, you find yourself attracted to this guy, you need to squash that. You need to avoid it. You need to do whatever you have to do to not engage it and not think those thoughts at all.
Take a cold shower.
Yeah, whatever. Bounce the eyes and all this. Like, I recently told a client, don't bounce the eyes. Like,
bounce the eyes.
Because like just like that approach we often use with guys who struggle with lusting after women. Oh, whenever you see a hot girl, bounce your eyes. Like, well, what message are you sending your brain? That women are dangerous, that they're all seductive, and that you can't control yourself. It's like, maybe for a period you might have to do that if you're so addicted, but we want to get to that place where you can handle it, that you can see them and see them as a person.
Yes.
So what we do is we use the fantasy, we use the lust experience. We don't tell them to lust, but rather go to that point where you felt the attraction. And we're going there not to lust, but rather to gain understanding.
Okay.
So go into the attraction experience, whether it's a fantasy or an acting out experience, and we use that as a window. So we take a non-judgmental look and just like, what can we learn about that experience? And oftentimes we get to some underlying emotions, which then lead us back to some past experiences, and oftentimes some sort of past wounds underlying those experiences. And so the battleground is on three fronts. We go back to the past, we excavate as the client sees fit, they guide the process. See, even though I have this whole model in my head, and people who might watch my videos might learn about the model, they can read books and learn about it. I'm not starting the therapy by explaining all this stuff to clients.
Right.
I'm not imposing a model on them. I might have ideas right away. Someone could tell me their story, and I'm like, right away, I'm making ideas, but I don't point those things out. I'd rather have someone discover those things on their own.
That's good. Yeah.
Well, just in general, principle of counseling is people don't dispute their own conclusions.
Yeah.
So it matters more when you figure it out, when you discovered it. And so well, let's look into the attractions. Where does this take us back to? So when they make that connection, then we resolve that. We do some sort of trauma processing. Then we come back to the present, back to that fantasy or that acting out experience, and see, does it feel different? And oftentimes we're like, it's not as interesting, it's not as captivating, it's or it's disgusting now. I don't need that anymore. So you see the change there as we do the work on resolving underlying wounds. Now, it doesn't totally take care of it as a pervasive issue necessarily, but you can see on a continuum the same-sex attraction moving.
Yeah, and that's where I contacted you, because I was watching one of your videos, and your website or your YouTube channel is PsychoBible, correct?
Yes.
And it's down there. You can find the link on our below this talk if you want to find out more. Andrew has some wonderful videos there. The one that I was interested in, you did an interview with Carolyn Pella and is it Philip Sutton? Or
it was Carolyn Pella, and she had done a research article studying Nicolosi's approach.
Okay.
And so she wrote it with Phil
Just the one that you just described, the Nicolosi approach. And this was a very well done study.
So I interviewed Carolyn and Joe Nicolosi Jr.
That's right. Joe's son. Yeah. And what you found is that, and it basically you had like 70 men, I think, all men.
Yeah, 75 men going to Nicolosi's practice. And it was a longitudinal study. I forget when she started. It was like maybe 2014 that she started the study. And so brand new clients, so just coming in. So what this was going to be was the first ever prospective study on, in particular, reintegrative therapy, which is the current version of Nicolosi's model. And to definitively see if this type of therapy was effective, as well as how much of a risk for harm would there be. Because the myths that are out there, the constant lie is that therapy for unwanted same-sex attraction is harmful, it's dangerous, and it doesn't even work. Okay.
Right.
Well, it depends on what you mean by work, because if you're expecting a categorical change, well, that's just not the point, and it's not realistic.
You
Because
may get a better idea of who you are, and maybe,
well,
but
it's
what they
change
say,
is always on a continuum with any issue, really.
gotcha, yeah,
You know?
absolutely, yeah,
So, like, you wouldn't say to someone with, say, struggling with alcoholism, if you go to rehab, and if you did, say, years of counseling for that, and if you still had the desire to use alcohol sometimes, well, obviously therapy didn't work. You
yeah,
wouldn't say that.
you
If
would know.
they experience some change in their desire for it, and they increase their defenses and their coping strategies for when they are tempted, and they have been sober for a while, and they're living like a more clean life, you would say, hey, that's a success.
Yeah, or maybe it's just a matter of, I still drink, but I don't want to kill myself anymore. I don't know.
Yeah, they could.
You
So
can have success.
what you determine as success in therapy is way more broad when it comes to every other issue. But when it comes to this issue, we have a very narrow-minded set of criteria for what's successful.
Yeah,
And of course, if it's dangerous or not. Like we have this narrow-minded idea here, but in her study, she pointed out how about 40% or so of people going to counseling for depression
okay,
experience no benefit.
yeah,
So therapy isn't even beneficial for clients going to counseling for depression 40% of the time. And then there's a certain percentage that experience harm. I think it was like 30% or something like that, 15 to 30. I'm trying to go off the top of my head, but it's in the interview. So
yeah,
it's like you can actually get worse than going to therapy just for regular issues. Okay.
yeah,
So when people talk about therapy for same-sex attraction being harmful, you first got to ask, well, compared to what?
that's a good point.
Because compared to counseling in general, therapy in general has a risk for harm. So is it as harmful as that? And if it's as harmful as therapy in general, then why are we just going to try to ban that therapy? Why not ban therapy in general? Well, we're not going to do that, obviously, because of politics.
Right.
And so what we actually found in the research was that it was actually more beneficial, like significantly, statistically speaking, than therapy in general. And so, because she studied well-being, we used a measurement, or I say we, but they used a measurement that prior to starting treatment, or at the start of treatment, they measured their well-being, and they found that going to therapy, they were significantly distressed. Okay.
Okay.
By the end of treatment, they were well below that criteria marker for clinical distress. So they're in the place of being, they're just at the point of being well adjusted like any regular person on the street, depending on where you live.
Yeah, right.
What street you live on, I don't know.
Yeah, right.
But it was in the healthy range.
Right.
So actually they got healthier, even if they might not have experienced as much change as they would have liked.
Now, the men that came in, what did they come in for? Did they all come in for the same thing, or were there different things? And they but they all had the same therapy.
Yeah, they all got the same type of therapy. I don't know. I forget what the study showed as far as what all their clinical goals were, but the idea with reintegrative therapy is it's not change the attraction or change. We don't even use the word orientation,
right?
Really, but it's not to change the orientation, but rather let's explore it. Let's see what happens if we go beneath it. And really, it's more we view reintegrative therapy as an approach for trauma and addiction. And as we work on the underlying emotions and wounds that may be beneath, that the client identifies as being beneath those attractions and fantasies and behaviors, well, as a natural byproduct, does that impact your degree of same-sex sexual attraction, your sexual identity or self-concept, your behavior? And is there any shift on the continuum for opposite sex attraction, behavior and identity and thoughts? So what we found is, yes, there was movement along a continuum in a reduction of homosexuality in those different dimensions: thoughts, feelings, behavior, and identity, and some degree of increase in the opposite sex attraction when it comes to thoughts, feelings, behaviors, and identity. So
okay, go
and
ahead.
this is a case where even some guys who came in identifying as gay already, they just were open to exploring things a bit.
Right.
So we don't go in trying to force a certain outcome, but just let's explore, let's see what happens.
Let's explore, and then we'll measure based on these measurement tools that psychologists have come up with and feel good about. These tools have been controlled. They've been control tested and that kind of thing, I assume. And you found out that same-sex attraction would diminish significantly alongside a well-being, which what we all agree would be well-being, feeling good about yourself, adapt to life, I guess.
And the well-being, one thing that Carolyn Pila pointed out was that the well-being improved pretty quickly in the therapy.
Wow.
So that was probably the thing that was most significant, because the constant accusations that were harming people, but rather fairly early in treatment, their well-being improved. And I think that's proof of what we actually do in this therapy is actually we're helping relieve the shame and that burden. So when they realize, oh, okay, I can talk about this issue that I've been bottling up and struggling with. It's safe to talk about this with someone, and we're not judging them for it. We're not using a moralistic approach. In fact, some people talk about Nicolosi's approach as being, it's just behavior change. Even Christians, I remember Al Mohler talking about reparative therapy and claiming, it's just behavior change. Just speaking out of ignorance, really, because if anyone, Joe Senior and Junior, their approach is the least behavioral. Because you could watch footage of Joe Nicolosi Senior, and a client will talk about acting out multiple times, and he doesn't even care. He's like, okay, tell me about it. Let's tell me how did it feel? What was it like? And we just show this acceptance. And I got clients who they'll act out sometimes. I'm like, I'm not judging them. I got a client who I've been working with who then told me, I think I'm going to explore homosexuality now. I'm like, all right, because he's all nervous to tell me, like, you told me before that you're not going to be pro-gay or anti-gay. I'm like, yeah, true, but you committed when you just started counseling that we're always going to look into it. All right, our approach is to explore the attractions, to see what's underneath it. So, do you want to identify as gay now? All right, but if you're going to continue therapy with me, the approach we're taking is looking into the attractions. So, but either way, there was a sense of relief within him when he knew that I wasn't going to judge him, because he's terrified to tell anyone else in his life that he deals with this issue.
So there's shame which keeps it hidden, and it seems to me there's a therapeutic benefit to feeling confident enough, secure enough and what I think the Bible would say, to confess your sins one to another. And I'm not calling this sin, but in a sense, that's the purpose of it.
And sometimes they are literally sinning. I mean, especially I'm working with a variety of guys, not all of them Christians, but I'm working with a lot of Muslims, work with some Jews, and sometimes some guys who aren't even religious, but they're like, this doesn't fit who I am and what I want for my life. I want to actually have a wife and kids someday. So, but they're not really religious in any way. So, like, great, you should have that right to do whatever you want. Like, as therapists, we have a code of conduct and ethical principles, and one of those principles is self-determination.
So you'll have a man will come up to you and say, "Look, I'm attracted to men, but I really want to have a wife and kids, but I don't know how, and I don't even have an attraction."
Yeah, and this is how I would say this type of therapy is different from a lot of ex-gay ministries.
Okay.
Because a lot of the ex-gay ministries, even those that are in the more transformational approach or the rebuild stream, will often make it more about just coping with the same-sex attractions, not acting out on the behavior anymore, but not really addressing the feelings that much. What we're doing is we call this, like, reintegrative therapy would be a particular approach under the umbrella of safety, sexual attraction fluidity exploration in therapy. So you can use, yeah, it's a name that the Alliance for Therapeutic Choice coined back in like 2016, because they wanted to differentiate themselves from conversion therapy, especially, but also SOCI, sexual orientation change efforts, because SOCI is too broad. It includes self-help, religious interventions, pastoral counseling. It's not specific enough to be about professional therapy. So we want an approach that says, okay, we want to talk about actual therapy to explore sexual attraction fluidity, meaning sexual attraction change on a continuum. Okay, it's because we don't view people as categorically different. So it's an experience that is on a continuum. So we're actually trying more with these therapies to be open to the attractions themselves, the feelings changing. A lot of the ex-gay ministries don't focus on that as much as they do just, being dedicated to Christ and the underlying motivations. So even a lot of the therapies, even a lot of the ministries will be kind of standoffish when it comes to therapy, because they're worried about being associated with conversion therapy, or that clients being disappointed if they try some sort of therapeutic approach and they don't get the level of change in their attractions that they're hoping for. It's really funny how much we value feelings. Like everything else in your life could change, but if your feelings don't, like that's the clincher. It really shows how much, just in therapy in general, people come to counseling, and oftentimes what I'll tell people is, a lot of people come to counseling. You could have all sorts of bad behavior in your life, but people won't come to counseling until their feelings are affected. When now they start feeling bad about the things in their life, and it's affecting them and their relationships. So yeah, emotions are important. And so a lot of ministries, they don't want to touch the feelings part. They just work on the behavior or their commitment to Christ. And that's great. I think that's important to have, because that helps with the underlying motivation, because I don't impose on them any sort of, I'm not doing accountability with my clients. Like, the approach I take with my clients is a little different than the support group I led for years, where it was more accountability based. With therapy, I'm not telling them what their goals are at all. I'm not telling them, well, here's how you should live. Even if they're fellow Christians, I'm saying, hey, you know better. Nope, I'm not taking a moralistic stance at all, but I do think they still need churches and pastors to preach the truth about sexuality. So, but that's not my job to do that with the clients. It's like, what are the goals you have? And we'll work on that. So even when I get a client who's still engaging homosexually, I'm like, okay, well, what do you want to work on? What's your goal?
Okay, yeah. So let's take it out of homosexuality and talk about, say, a man who loves his wife, but he's constantly looking for affairs, and maybe he's falling into affairs, and he says, man, it's almost like I don't know what to do about it. I that kind of thing. It sounds like maybe the same kind of approach, more or less, for that person.
Now, sometimes they do want to work on the behavior more, and I'm like, okay, yeah. There are times where, to get to working on the underlying emotions, behaviors, the underlying emotions and wounds, sometimes you do got to stabilize their behavior a bit more. So, especially if there's an addictive element. So I'm not saying, well, we just ignore the behavior totally, because we do an assessment to see how addicted they may be. And I'm like, okay, if there's an addiction element, we do want to work on that. And that'll help stabilize more and make your life more conducive to therapy in general. But it's not through moralizing. It's not through saying, hey, you know better, stop doing that. That's easy to do as a lay counselor, just to say stop it. But real therapy isn't about that.
I can't. So, okay, then I'll shock you.
Okay. Yeah.
Lift up that cigarette. I don't know, and we'll do that. Whatever. I don't know. Electroshock therapy is gone, but here at our church at Sunrise, we're going through a book by a Dr. Rob Reimer called soul care. And a lot of what you're talking about is principles that he discovered in his research and in his work as a counselor and as a pastor, and mostly in his search to deal with the issues in his own life. And what he's been talking about is it's important to find someone you trust and confess your sins, and then, going into religious aspect of it, sin, whatever, he talks, he's very vulnerable about his own life. He said, my wife and I were not getting along, and he had to do a deep dive search into why. And he says, and some of the things that you talked about dovetail really nicely with what we're learning. And I'm learning for myself that as I go deep and, okay, these are issues that I want to deal with. And he's, and I'll just go and I'll say, where is it coming from? I'll ask God, what is it? I'll think about things in my childhood or adolescence, and I'll go, okay, I think you want me to go here, God. And he says, spend time with God. Take the time to spend the time, get alone. But it's also, and the therapy part of it is like with you, as you're a therapist, is to find someone that you trust and confess these things. And shame is a big issue as well. The idea is that whatever that thing is shaming you, you're keeping it bottled in, and you need to somehow release it. And I think this is what happens. Like, I think the Catholic priests that have the confession, you go into confession, you confess it all. They go out, they'll feel really good, do some contrition to prove that they're better. But then the next step is they come back maybe next week and they get another shot of feeling good. So the next step, of course, is what do you do to build on what how you've dealt with shame. For the Sunrise people watching this, I think this, Andrew's therapy method dovetails really nicely, and you don't have to, it sounds like it works. It works really. I think all God's truth is God's truth. His principles work. They work really well if you're, if you've got God in it and you're working with him, because there's nothing like having a relationship with God, nothing like your creator, saying, hey, I want you to work on this. Here you go. And he's the best counselor you could possibly have, but you need another person with you on that journey, because the shame, the only way to really, it seems to me, the best way to remove shame is to confess it. And you got to be in a safe place. What do you think of that?
Yeah, well, and I would make a distinction there between guilt and shame.
Okay.
Because
Good.
guilt is when you've done something that you didn't live up to what your standards are. You've done something that you shouldn't have, and so there's that conviction, that awareness of failing, of committing a wrong. And of course, there can be true guilt, and then there's false guilt, or more like anxiety. Like when you just, like true guilt, it's like you did something wrong. Okay,
Right.
you can identify it.
Yeah.
And so when you confess,
I broke that
confessing.
window, and I lied when they said, "Did you break that window?"
Yeah.
And shame would be.
Shame is that sense that there's something about me that makes me unacceptable.
Okay.
So it's an evaluation not of your behavior, but an evaluation of who you are.
Yes.
And it's a relational based emotion. It's about who I am in a relationship to others, to another, maybe just another person, or maybe to a group, to a family, to a church, to a society, to your own sex. And there's legitimate shame and there's illegitimate shame. Most of the time in counseling, we're dealing with illegitimate shame.
Okay.
Where they've come to be ashamed of themselves, and it's not justified. It's like they've been hurt and wounded so much that they've come to believe the lies about who they are, that they're unworthy, that they're unlovable, and there's something wrong with them at their core. And those aren't true. And so the solution to those isn't necessarily to confess them as if you would confess a sin, but rather but in a way, like confess, more like to reveal.
Reveal.
Okay. So
good.
One of the things we talk about is the main solution to shame is the double loop experience. Because what happens prior to shame is what we call a double bind. That there's this feeling I have, there's something, I feel bad about something, but if I address it, if I bring it up, if I reveal it, if I'm honest about it, I'll make things worse. So it's a lose-lose scenario I'm in.
Okay.
So there's that feeling that if I'm genuine, if I authentically express what I'm thinking and feeling, what I'm experiencing, it'll just, based on my past experience, I'll make things worse. So I got anxiety about it.
Okay.
And so what that does, you're not being authentic. And that puts you in that shame posture.
Okay.
So the solution to that is what we call a double loop, where you voluntarily reveal, you expose that thing that you're ashamed of. And so with every double loop experience, there's that risk for harm. There's a risk that comes with, but also there's a potential for reward. So if I say, is one of the videos I share with people is a video from Joe Nicolosi Sr., where he's explaining this model. And he gives the example of, say you got a client and he was acting out, and it's like, well, how are you feeling before you acted out? Well, I felt terrible. Well, that's because he was in what we call the self state of the gray zone, where he just feels down, he feels ashamed, he feels anxious, he feels blah, he feels numb, fearful, and you're just down here. So we act out from that gray zone. Well, what puts you in that gray zone is a shame experience. And so you trace it back to, where was that shame moment? Well, I was feeling pretty good on Saturday. Well, what happened Saturday? How about Saturday evening? Well, I was feeling pretty down on Saturday evening. All right, what happened between Saturday morning and Saturday evening? Well, I was out with a friend. Okay, what happened with your friend? Well, we're talking, and then you start to identify, zero in on where the moment was where he felt disconnected from his friend, where he felt other, like he wasn't being affirmed by his friend, really being valued. And it might be a moment where he's talking to his friend, and he knows his friend keeps looking at his phone instead of talking with him. And he goes into the shutdown. Well, that's the shame moment. And if he stays there, if it's not addressed soon enough, then he goes into that gray zone. And then when you're in the gray zone, then this same-sex attraction stimuli or other, I've used this model to work with guys with other addictions. It's the same model I would use for guys with pornography or same-sex or heterosexual sexual addiction issues. So, but in particular, this really fits with guys with same-sex attraction.
Or maybe overeating, or
yeah,
okay.
Yeah,
Alcohol. Okay.
Sure. Yeah, anything really.
I feel really down.
It's that there's that shame moment. There's something about me that makes me unlovable, makes me unworthy, that makes me unacceptable, and it's an overwhelming, powerful, negatively powerful experience. Shame. And so we then drop down, we disconnect, and shame is the opposite of being in an assertive self state.
Okay.
The assertive self state is one where you're authentically expressing yourself, your thoughts, your feelings, you're being active and meeting your needs. And so shame is the opposite of that, because there's that double bind experience. Well, if I'm honest, if I'm authentic, I will be rejected.
I see.
So here's my friend, and if I say anything about, oh, he's looking at his phone the whole time when I'm talking to him, he's just going to call me a big sissy or a baby. And so I go into shutdown. Here he is rejecting me. And what it is, that's just a pattern from throughout life that's being repeated. Like, oh, man, there reminds him of times when he wanted to hang out with his brother, and his brother would just ignore him. Or his dad was too busy to give him time of day. And he felt the shame there. Well, what happened then? He shut down. Okay.
Yeah.
So the double loop is to share. Well, the risky one, or the most risky, would be to share with that friend, hey, right now I'm talking with you and you keep looking at your phone. And when you do that, I feel angry. I feel sad because I really want to have your attention right now. I want to know I'm valued.
Vulnerable. And that's being vulnerable, to be able to say, you're putting yourself in a vulnerable position. So it's dangerous.
Exactly.
It's easier to just say, I don't want to, because what's he going to do? He's going to defend himself, right?
Could. There's that potential.
Yeah.
Or
like you said
he
earlier,
could hear you, and he could show, oh, I'm so sorry. He can show that he understands what you're experiencing and still show that he accepts you. And that undoes the double bind. And so it wipes out the shame. When he's able to hear you. And that's the double loop experience.
Yeah.
Because, all right, I'm sharing now with you authentically, and you're hearing it, you're understanding it, and you're accepting it, and you're giving me positive feedback in response. Now there's a double loop between us.
And that's 1 Corinthians 13, love one another, as the way you want to be loved, and we love your neighbor, love. Anyway, yeah.
Yeah. Well, I mean, this is practical stuff for people who don't even struggle with same-sex attraction, because how many times we work with guys and they don't know how to deal with their emotions, and they just shut down, they do their own thing. They don't like, you want me to actually talk to my friend who hurt my feelings? I'll look like a little baby.
Yeah, right. That. Yeah.
And it's like, we don't know. It's like, it should be normal interaction to tell someone how we feel when we're interacting with them. And I've had to practice this. There's times where in clinical supervision, my supervisor said something that bothered me. And well, what would I normally do? My old Andrew would internalize that and beat myself up. And
I'm so stupid.
Or foster a resentment toward that person. Oh, he's just a jerk. He don't understand what I'm going through. But no, as I've grown, I've learned I need to be assertive, because I have the opportunity to potentially repair that rupture. And so next time I had supervision, I'm like, hey, can we talk? You said this to me last week, and I felt like you weren't really understanding me, and I felt angry, and he didn't even necessarily have to agree with everything I'm thinking and feeling. But what was important was for him to show that he understood what I was experiencing. Right. And then for us to actually come to common ground. And that resolved that bitterness there. And the relationship improves. How many broken relationships do we have in churches and in our families from people just not sharing what they're really feeling and thinking? Yeah. So when a client goes through this and they start applying this stuff, they become healthier people in general, let alone if it helps resolve their same-sex attraction experiences. At least they begin the process of having better relationships. Yeah. They become more present and mindful and attentive to their thoughts and their feelings, and they really care about having genuine relationships. The whole church would be better off with that sort of approach to things.
Yeah, amen. And we're learning that in our own church now with the book. The writer talks about how his wife started shutting down because he was pretty much ignoring her, and the struggle he had to affirm her, to recognize, but all those things are just things that we need to work on. I guess it's probably time to wrap up now. So what I want you to do is, if you could just, there might be somebody here watching this that says, man, I'd like to get a hold of Andrew, maybe do therapy. Do you do therapy on Zoom? You're in Pennsylvania. We're here in Seattle.
Yeah, I gotta be careful because of state regulations, counseling people across state lines, but people can definitely get in touch with me, and I'll do my best to assist them, or maybe refer them to someone else.
Okay, what's the best way to get a hold of you?
Well, definitely check out my YouTube channel or my other channels on the other alternative platforms. I'm on Rumble, Odyssey, I'm on Facebook, I'm on Parler, I'm on Locals, and all that stuff. I look for PsychoBible. It's one word, PsychoBible, babbling about psychology and theology. You can email me. I have my contact info on those. So I'll give you my email address, and I'm in the process too, once I launch my website for my new counseling practice. So I'll probably put that email out there more. Awesome. Yeah, I would say look for me on those different sites, and they can contact me through those sites.
And primarily. We have the links. I'm going to put the link not there now, but I mean, the links will be there. So below this thing, when you hit the subscribe button, look for the link as well.
Yeah.
All righty. All right. Well, Andrew, this has been a real pleasure. Thank you so much for taking the time, and best wishes. We didn't even touch subjects.
I know there are some things I know you wanted to bring up, but we didn't even get around to it.
I know.
But
I really maybe
I give
next
long
time.
answers.
I saw some videos. I said, I really want to ask you about what you think about what Milo Yiannopoulos is going through right now. And I saw you had a couple of videos about that.
Yeah. I don't follow him that much. I just, every now and then I hear something about him. So I made a couple of videos, but I'm not like following him on Telegram like some other people are. So I don't know what the latest is with him right now.
Yeah, well, I mean, he's out there. He says, "I prayed away the gay." He's a provocateur,
He is.
and he loves to just throw it out there. And anyway, but that's for another subject, another time.
Sure.
Anyway, God bless you. Have a great rest of your day, and we'll see you on Facebook.
All right. Same to you, Rick. Take care.
You
Bye.
too.